I'd like to call to order this meeting of the Sacramento County Board of Supervisors for April 1st, 2020. Madam Clerk, will you please call the roll on the staff quorum?
Supervisors Frost.
Here.
Kennedy.
Here.
Natoli.
Here.
Peters.
Here.
Cerna.
Here.
And you have a quorum.
Thank you.
This meeting of the Sacramento County Board of Supervisors is cablecast live on Metro Cable 14, the local government affairs channel on the Comcast, Consolidated Communications, and AT&T Uverse cable systems. The meeting is closed caption and is webcast at sacmetrocable.tv. Today's meeting will be repeated Friday, April 3rd at 6 p.m. on Channel 14. This meeting is also broadcast live on KUBU Radio on 96.5 FM. A DVD copy is available for checkout from any local library branch. Members of the audience wishing to address the board may fill out a speaker slip and hand it to staff. Please take a moment to silence your electronic devices at this time.
Great, thank you. Will you please rise and join me in the pledge?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you. In compliance with directives of the county, state, and Centers for Disease Control and Prevention, CDC, this meeting will be streamed live and will be closed to the public. Those wishing to view the meeting can do so using the following websites. Metro Cable 14, the website is metro14live.saccounty.net. You can also go to the Board of Supervisors page at sccob.saccounty.net. Members of the public are encouraged to participate in the meeting by submitting written comments electronically. Comments submitted in person will be delivered to the Board of Supervisors by staff. Public comments will be accepted until the adjournment of the meeting, distributed to the Board of Supervisors and included in the record. Those wishing to submit comments electronically can do so using the following web addresses: boardclerk@saccounty.net. You can also use the following address, sccob.saccounty.net. And of course, again, you can submit your comments in person here at 700 H Street. However, the comments will be collected outside of chambers and delivered to our clerk and to the chair. So with that, I think before we get started with our first item, I just want to take a brief moment and again thank everyone for their collective focus on limiting the transmission of the virus. I want to specifically mention our first responders and our health professionals, healthcare professionals, our doctors, nurses in our community that are really on the front lines doing everything they can with what they have to keep us safe and healthy. So I just want to make a note of public thanks to those folks. Now our first item.
Okay, so you have two consent items, and I do not have any notes regarding those consent items.
I just have a very brief comment that I wanted to make, and our Bruce Wagstaff and Eduardo from DHA and Jeff Gassaway are here too if you need any details. But the comments I wanted to make is that this is a step one in a fairly long strategy that we have for folks that are homeless that potentially could be exposed to the coronavirus. What we're asking you today to do is to authorize the DHA director to enter into lease agreements with hotels and other places that they can house them during this crisis. The county is receiving about $997,000 from the state to help with this endeavor. City of Sacramento has $2.2 million, and Sacramento Step Forward has $1 million. They've been participating with us on how to manage this situation, and we anticipate entering into MOUs with them where the 2.2 and the 1 million will be commingled with these funds to expand the pool. So there'll be about 4.3 million that will be available to shelter homeless folks as this crisis continues. So that's what's in front of you today. While this is going on, the federal government has also indicated that they're willing to put some CDBG and emergency service grants to local jurisdictions. They're still working through the details. We could find them as quick as next couple of days, or it could take 2 weeks. Our intention is that if we find out in the next couple of days, is that we will come back to you next Tuesday, have similar type conversation. This is what money this is what's eligible for with our recommendation, and get board input. Is that the direction you want us to go in? So whenever we're ready, we'll bring that forward to you. If it will be on the agenda for Tuesday, but if we do not have the information, we'll just continue the item for a further date.
I do have a couple of supervisors queued up here to speak to this item. Before we go there, real quick, Mr. CEO, do we have the ability then, in concept, perhaps to look at how we might leverage whatever new federal resources we might acquire in partnership with other jurisdictions, just in concept?
Correct. And they're all participating with us. City of Sacramento will be potentially receiving funds too, so that will be in concert with them if they want to do the same program as we do.
Very good. Supervisor Tully?
Yes, thank you, Mr. Chair. Now, I have a couple questions. One being that the money, as I understand it, will be available for testing. And if we're bringing folks into a shelter setting, I guess I would be very interested to know what is the protocol for folks that we're going to house in a communal situation. For example, I heard on the news last night, I don't know, maybe you can elaborate on it, Bruce, that we brought additional beds in at Mather. We have individual living quarters, but we also have communal dining facilities there. I don't know what we're doing around that, but I would hate to see us, by virtue of housing folks, that we then bring in folks who may be infected, either or carriers. And again, I know testing turnaround isn't all that quick, but I guess I'm curious about, so what are we going to do? And even with the hotel motel situation as
Right.
well, because you may mix populations with others who, still are traveling or they're on an intermittent basis, visiting this community or whatever, so.
So Supervisor, thanks for the question. Bruce Wagstaff, Deputy County Executive. The whole purpose here, of course, is to mitigate the spread of the virus. And as Dr. Bielenson would say, this is a very key part of our effort to mitigate the virus from spreading more than it already has. So to the extent you're dealing with the homeless population, yes, if you're dealing with somebody who's tested positive, you do have to, that's why we're looking for hotel rooms and things that where those people can be isolated with quarantine, supervised by providers, and that sort of thing. But the whole idea here is to provide that separation so that you're not contributing to the spread of the virus. So wherever we put these people, and our focus is on those who have tested positive or who have been exposed to somebody else who's been tested positive. In particular, the vulnerable population, as Dr. Bielenson has talked about so many times, the over 65 and those with chronic medical condition, and then those who have tested positive who might not be in the vulnerable population. But to your question in particular, every effort would be made to keep folks separated so that we live up to the real purpose of what this is all about to begin with, okay? As to Mather, Supervisor, it's been in the mix for discussion. Our focus right now, and what's before you today, is for the authority for DHA to move forward with their lease discussions with motels, okay? But as Nav said, our intent is once we get the federal dollars nailed down, that we can be back before you and lay this whole thing out for the use of all the different funding sources. We hope that's next Tuesday.
Bruce, it was reported on the news, again, maybe it was erroneous, but that they delivered more beds or cots to Mather for accommodating homeless. I mean, that's more than being in the mix. It sounds like it was already a done deal.
Well, there's been some cots delivered that are being stored there, Supervisor. Okay. But there has been no decision about how best to use that equipment.
Okay.
That's what part of the group is looking at.
Okay.
But yes, there was a request, and state OAS was responsive to that.
Okay. Again, I just got a bits and we're inundated with a lot of news on this, and so back to the testing though. So I've talked to one of the providers who, well known to folks in this room, and again I won't call them out, but the concern is that they have a population already that they're being very careful about either testing provisions and or sanitary conditions for those that are in shelter.
Right.
And there would be a willingness, as expressed by them, to maybe accommodate some additional bed space for folks, but concerned that it's one of the things if you know they've tested positive, but that you introduced it into already a cloistered
Right.
situation. And so I think they would like to, know that there were either test kits available or some testing regime that would allow them to be a partner in providing, some of the beds in habitable space for folks. But they need to have those assurances. And they're not the only provider. This one obviously has a number of folks, including children, so you might guess who that is. But I want to know about that. So what is the...
So there's been regular interaction with the providers of our homeless community supervisor through conference call, obviously. But anyway, was just one the day before yesterday, as I recall. Talking about the equipment they need, the supplies they need. As to testing, as Dr. Bielenson has said, we've been limited in the number of test kits we've had generally.
Right.
And that's getting better. Peter was advising me last night about additional testing possibilities. So more and more folks are being tested, including more of the homeless. To date, not that many of the homeless population has tested positive,
Right.
primarily because they haven't been tested.
Sure.
But we know that to control the virus, to mitigate the virus, this is a very important part of it. And so we're working closely with the providers. One of the aspects of our plan is with the shelters and the providers now, what they need for testing, but also for quarantine purposes.
In order to
and-
accommodate.
That's right. But I can assure you that we're in close contact with them as putting this plan together.
Okay, could I just, one other question then, it's related to what you just responded to. And so how many tests are now available on a daily basis to this county for, and again, I know hospitals may have had some allocation, so what, you can parlay that however you want to describe it, but what are the number of tests that are?
Supervisor, I actually don't know what the number is today. I can check with Dr. Bielenson and get back to you on that.
We'll send out a board alert. We don't have that number with us at this
Okay,
point.
because, as recently as, a handful of days ago, it was only 20. Now, I know
No, it went up to 30, 40. Number keeps changing, but we'll send something
it's
out.
still a pretty, very, very modest number, though.
It's getting better, and of course, they're doing the drive-through testing possibilities now, working with a private firm. So
Do we
we'll
have
to-
drive-through
we'll have to get
testing
you-
available in Sacramento
We'll have to get you an updated number.
There is a drive-through at Cal Expo that folks can go through, so it's not just, there's a county number, then there's a number for drive-through. We'll get you, I think there was an update, but we'll get you one that has that information.
Okay,
I just think I saw it somewhere. I just need to get that back to you guys.
I think it's important for board members, all of us, to know that.
Absolutely,
'cause we get
absolutely.
inquiries
I
about
think
that.
that had criteria to the drive-through that you had, I don't know if it was your doctor had to give you.
You had to make an appointment.
Yeah, you have
right.
to make appointments.
That's
It
correct.
wasn't-
So it isn't just like, we don't want to
Not
get
drive up.
a million
No.
people lined up over there.
No, it's got to be a reason behind it. There's a whole thing that we did on it. We can refresh that and send it back. I think there's an update coming today, Tuesday? No, today's Wednesday, I'm sorry. Yeah, there's an update today we're doing, so we'll send that out.
All right, thanks.
Supervisor Peters?
Thank you. Nav, I'm wondering, on the hotels, a month ago, the state OES was finding out all the hotels and spaces, and now the Corps of Engineers and everybody's in it. So has the federal and state government, have they decided which areas are going to be negotiated to be available for this project?
Go ahead. Yeah, if I may, Supervisor, we've been in touch with the state. The state has done some discussions with motels. Frankly, in the interest of mitigating the virus here, we've also taken some initiative on that. We have approximately 200 motel rooms lined up. We're in regular contact with the state, though, and frankly, the rate we've gotten for those rooms is
Well, that's
better
the-
for our
that was my
purposes
other
than what they
question
were
is-
talking about.
Is
But
the
in any
negotiated
event,
rate?
yeah, so we've got about 200 rooms lined up, but the plan here is not to make commitments for all those rooms right out of the gate. We don't want to be paying for
See if
empty
you can fill
beds.
'em.
That's right. So Ann and her staff are in close negotiations with a given motel right now for about 80 rooms. Generally, the plan is you nail that down, you start putting people in those rooms, you get to the point where that's full, you bring on more rooms.
Yeah.
And that's, so it's a fast-moving plan, but it's a graduated plan, so that we're not paying for empty beds.
So the other
In regular
part-
contact with the state.
Yeah, so the other part of your question, I think the state is still looking for if they have folks from cruise ships or planes that need to quarantine, they're still looking at having some kind of relief for hospital.
Hospitalization motels? Yeah.
And Army Corps has come into it, and they're looking at they're looking at sleep train at this point. Are they going to put a field hospital, which will take away the need to do the hotel? So they're all, as Bruce said, it keeps evolving. And Army Corps, I think they've identified 2 or 3 sites in the state where they want to do these field hospitals.
Right.
So that will be part of the mix that comes into it.
Okay, but we're going ahead with the hotels while they're working that.
Correct.
Yeah, with your authority today, if you approve this item, DHA moves forward with its negotiations and we get that ball rolling.
Yeah. And who sets the rate, the hotel room rate? Is
Well,
it-
it's the result of the negotiations between folks at DHA and these hotels, and we've got a pretty good rate that we've gotten from that process.
Okay.
That allows us to line them up.
Okay. And you said there would be staff on site, not our staff, but
Right.
contracted staff. Will there be security on site?
That's a good question, and that's come up in recent days and talking to other counties, the need for that. And I think the short answer is we're looking for ways that we can provide that, yes.
Okay.
We don't have that nailed down, but certainly we know that you can't just put people in these motel rooms and just walk away from them. You know, you've got to have services provided. You've got to have oversight. Dr. Bielenson has worked with UCD to provide a couple of I forget the number of I think 1 doctor and a couple of nurses to work on this. I have to double check that. But it's not just a matter of putting folks in the rooms. You've got to have the other services that are necessary.
Thank you.
Supervisor Frost.
My question relates to the regulatory framework that we work under with the hospitals and ERs. I'm wondering if the hotels will operate under that regulatory framework whereby once we take in a patient, the question is, will we be wrapping them with services and trying to connect them with housing and addiction treatment, and then when they're ready to leave, are we required to, we don't want to release them back out in the cold, so what is our exit strategy
Sure.
as we unwind
If
this?
I could take that part of your question first, Supervisor, because it's very important. In every conference call that I've been on with the team, we've raised this issue that it's not just a question of ramping this up. We've got to have a plan for ramping it down, too. And we're working on that. But certainly, if we have somebody in a motel room, efforts will be made to try to find permanent housing for that person for the long run. But what we have before you today and what we'd have before you next week is a plan to deal with the COVID pandemic, that crisis. It's not, and so the funding is only for that purpose, right? So we're going to have discussions with providers and others about how we ramp this down as the crisis unwinds. Do I have that all lined out for us today? No.
But it's on
that's
your
certainly a
mind.
priority for us to have to nail down. To your question about services for the people in the rooms, I think you were asking, Supervisor?
Well, yeah, because a lot of these people that are out there have Social Security and they have benefits, and if we can
Right.
connect them with benefits and
Right.
connect them with housing so they can go back out into a place, or a
Agreed.
job or whatever.
So it'd be my anticipation that the provider we bring in to provide the services and the monitoring, we'd also be working with those individuals to try to plan for what happens with them when they leave. I can't guarantee you what that might be, but we know that discussion has to happen.
I think it's an illness that kind of hangs on, and so some different people have a different severity of it.
That's
and
correct.
So it depends on obviously how severe they are, how sick they are, but I mean, it was on my mind, so I
Thank you.
appreciate that you're thinking about it. Thank you.
Supervisor Tully.
Yeah, just a quick follow-on. So in these arrangements with the lodging establishments, are we requiring that there be additional either hygiene or sanitation, either for the workers that are employed in those facilities? Because there's still going to be daily housekeeping, I trust. And so I assume there's a protocol, and you may negotiate a good rate, but this isn't just giving somebody a room and saying,
That's right.
stay in your room, and we'll busy. I don't know how you prepare meals for those folks. Do they do? So again, I don't want to get into all that detail this morning, but I would think that for the workers and for that establishment, particularly if you have folks who are isolated because they've tested positive.
Right.
But you still have those daily functions that you're paying for as a part of that, and so how do you protect workers? but also then to Supervisor Peters, maybe security, but personnel that are on, so that make sure that interactions aren't occurring that could, cause the spread either through people who
Right.
are unintended that are, a part of the workforce at those facilities and or amongst the population that's there.
Right.
So,
So very good question,
Yeah.
Supervisor. And as you point out, the overriding principle here is to control the virus, mitigate the virus.
Right.
So those employees, be it the provider that we're talking about or our own employees, themselves have to have the equipment they need, the sanitation they need, so that they're not catching the virus, and then we're giving them the protection we can possibly give them for that purpose.
you have
right?
daily housekeeping, you have hard surfaces, but you have
Right.
linens, you have, restroom
that.
facilities, all of that.
Yep. When we bring this back to you, Supervisor, we can give into more detail on that.
Okay, thank you. That's all.
Thank you. I had a question as well about kind of generally our approach to how we're accommodating those that are unsheltered during this crisis, and it relates to those facilities, those spaces that are actually either our assets that we own, that the county owns, or that we lease. Do we have a good assessment or inventory of what that is, what's currently being used? For instance, North A in the River District, and what might be deployed in the short term to
Yes.
complement the motels, hotels?
So your question, do we have a good inventory of that,
Yeah.
Supervisor? The answer is yes. I'll tell you, and we can get into more of this too when we come back, hopefully next week. But I can tell you that as we've talked about, the North Fifth Street shelter in particular was identified as an area, as one facility we might want to look at as we roll out this policy, potentially North A as well. Those discussions are happening.
Okay, and then this, just dovetail on that, for Nav, what's the intention for next Tuesday? Are we going to have an informational item generally for the board and for the public that's viewing remotely that kind of covers more or less, fairly high altitude level, what we're doing in the entirety of the county? It's obvious you're getting a lot of questions from us individually, and they're great questions. They're appropriate questions. But I'd like to maybe get a preview of coming attractions for Tuesday.
Yeah, it's going to be two-pronged. If we get the federal money and we get confirmation what the number is, the actionable item that will be in front of you will be to accept that money.
Okay.
To bring that in. Then what we anticipate at that point is we would have, at that point, all the money that's been available to help with this crisis with homeless. And as Bruce said, we want to lay that out for you to say, this is what we're doing. If we're working with the lodging establishments, we can procure X amount of rooms. This is what we can do with it. And if there's other things that the federal money allows us related to this, is to have that dialogue with board members. Is there anything else that you had in mind to let us know about it, rather than us just going on one path? So it's two-pronged on that one. We want to lay out, if we used all the money, and if it's for 90 days, this is what it will look like with the lodging establishment, how many rooms can we get to, and walk you through that. And then the second part is there anything else, as you're hearing this, in your districts, we get this money, if it's eligible for the COVID crisis, do you want to give us some input? Do you want to, where do you want to put the money at? If you're okay with our strategy on the hotel rooms, we're good to go. You give us something different, we incorporate that and we move on.
Okay, great. Thank you. I do have two written public comments. I believe both were submitted electronically for item number 1, no comments for item number 2. If there are no further questions by board members, I entertain a motion that it's time for consent.
Move it.
Moved by Supervisor Peters, second by Supervisor Kennedy. Please vote.
Unanimous vote.
Thank you.
Thank you.
Next item, please.
Mr. Cerna, did you want to take your off agenda, or do you want to wait?
Sure. Why don't we do we only have one off agenda. You want to read it into the record?
Sure. Hello, my name is Jeff Durbin. I appreciate the chance to write you and have my statement read at the next Board of Supervisors meeting. I am a resident of Sacramento County. I am still unemployed, and I have tried to postpone my second installment on my Sacramento County secured property tax bill by phoning the office number on my tax bill. The recording says that they understand what is going on these days, but they do not have the authority to postpone a payment, and that it is still due on the listed date, and that I will still incur an additional penalty if I do not pay on time. I keep hearing on the news about wanting landlords to help out tenants by allowing late payments, and Governor Newsom's statement today about relief for late rent mortgage payments by banks and financial institutions to prevent evictions, but I have heard nothing about the help with property tax payments. Thank you for your consideration.
Great, thank you. I suspect that at the conclusion of today's board hearing, at the appropriate time for comments from supervisors, we may hear some question and provide some direction to our CEO with regards to property taxes. So that'll be forthcoming here. All right, next item, please.
Item 3, you're adopting an ordinance relating to temporary moratorium on evictions during emergency. You waived reading on March 25th.
Great, thank you. So I'm going to move the item that we continue to move forward with the ordinance that we have set in motion here in Sacramento County. We're all well aware that the governor has issued an executive order specific to renter protection and evictions. Our county council, at my urging, has produced a memorandum that I believe all members of the board and executive staff have had a chance to digest, that more or less spells out the differences in between the two actions. But I think at this point, I think it'd be good to have county council maybe elaborate a little further in terms of maybe some of the nuanced differences. We've heard from housing advocates, at least I have. In fact, immediately when the governor announced his executive order, I heard very clearly some dissatisfaction and some concern that the executive order does not go far enough, or does not is not specific enough in terms of how renters are protected. And I think it's an important nuance for us to hear a little bit further from our county council.
Sure. Thank you, Supervisor Cerna. As I outlined in the memorandum that was sent on to Monday, the main difference is that the county ordinance precludes a landlord from filing an unlawful detainer action against a tenant that has proven that he or she cannot pay the rent due to a COVID-19 emergency. Unlike the governor's order, which allows a landlord to file an unlawful detainer action, but it just gives the tenant 60 days instead of 5 days to respond. So that's the main difference. I think the county ordinance is I think you could argue and say it's more protective because it provides that they would not have to defend an unlawful detainer action. And also there is a provision in the county ordinance that allows for payment of rent over 120 days versus in the governor's order that issue is not addressed. So those are the two main differences.
Thank you. And then one last question before we go to other members here. Am I clear? Is it my understanding that cities and counties can enact their own renter protection eviction moratoria ordinances or resolutions that are more protective than the state? They just can't go below the intent of the governor's executive order, correct?
That's correct.
Okay, great. Supervisor Frost.
So do I understand correctly when I say that I'm interpreting this as though the owner of the property will not be able to file an unlawful detainer until the 120 days is up and they have not paid? Do they have up to the last 120 days to catch up on the rent prior to? I just want to make sure I understand how that works.
Yeah, under, if the county passes this ordinance, again, it's not effective till May 1st, so that's another distinction between the governor's order, which is effective immediately. Sorry, forgot that part. A property owner could file an unlawful detainer action as soon as the emergency is over. So that may or may not be 120 days or not, but under the county ordinance, they would still have 120 days to pay the back rent. So it doesn't prevent them from filing once the emergency is over, but
It prevents them from finalizing the
Correct.
process?
Right.
Cute, thank you.
Supervisor Peters.
Excuse me. Thank you. When we were last discussing this ordinance, one of the primary things I asked was that the order come from the state so that it would be fair and equal to everyone. I think, in my mind, the differences are minor between the two, potato, so I plan to vote for this.
Supervisor Frost.
I guess I should just go on record as I plan to oppose this ordinance. I feel as though it's for the same reasons I have expressed before, to push the burden onto the owners. Only compounds our problems, and therefore I'm going to oppose.
Okay. There is a motion on the floor. I didn't hear a second. There is a second by Supervisor Kennedy. I will mention for the record that I am in receipt of one comment for item 3, this item that was submitted electronically. Any further questions or comments by members? If not, please vote.
And the motion carries. Let the record reflect that Supervisor Frost voted against this item.
Great, thank you. All right.
So now it would be the county executive comments
No comments this morning?
Okay.
and supervisor comments.
Supervisor Tully.
Yes, thank you, Mr. Chair. I received a call in my office this morning from a gentleman who was concerned because, one, he's over 7 years old. He pays his property taxes faithfully, both installments, in person, but because of the stay-at-home order, his own concern about his health and that of others, is not going to do it this year. He was also very skeptical about mail delivery, and that's his own view on that. And so he desires to pay by credit card, but we charge $53 in order to pay by credit card. And I think in light of the extraordinary circumstances, I understand we can't push back the deadline. But it would seem to me, again, we will incur some costs, but that if folks under circumstances choose to pay by credit card, who would normally pay otherwise either in person, but because of the circumstances. So now that is something that's in our control. That's a county ordinance. I don't know. We're 9 days away from the deadline. But for those that would otherwise pay in person, but would choose to pay by credit card, I guess my question is do we have the ability to waive that fee? I know the banks collect it. They act as the intermediary, but
What I'll do is I'll talk to our finance director if we have the ability. Let me discuss that with him. And
Okay.
if he can waive it, or what can we do?
okay, but it would need to be pretty quickly in order to get the message
Yeah,
out.
the minute
so-
we get done, I'll go find him.
And I was going to say, Nav, if that wasn't under your, his authority or your authority, if you needed to bring something back to the board, I'd be willing to consider that. Again, I don't know what the implications would be. I don't think we're going to have thousands of folks pay by credit card, but
We can look at it. If we need to, if we do it and I need a retro, I can bring it to you. I don't think you guys would scold me too much if I did that.
Okay. Well, I know that this is rolling out very quickly.
It is.
And the other thing is that that one came to light this morning, but the question about other licensures that the county, either has in place, business licensing renewals, other environmental management department.
Utility fees.
Utility fees, some of those things where we have the ability, again, we'll certainly have to make it up in the budget, but nonetheless, with those enterprises under utilities and so forth, where folks are having difficulty that might otherwise pay either in person.
No, we'll look at it comprehensively, not just property tax.
Okay.
We'll look, what's the other ability for, get the payments in.
Okay,
I'll,
right.
I'll talk to Ben and we'll
Okay.
do something.
And again, I just.
And I'll report back. I'll let you guys know about
And I
it.
thought, again, if it was appropriate, if you needed some additional authorities, since we're going to meet next week, and, property taxes, but other things, first of the month, due dates and so forth.
Understood.
that
Yep, I
you
can bring something if I need
All
it.
right.
Could I suggest that CEO is well aware that there's a request made to come back to the board kind of with a comprehensive suite of relief measures that might or do need board action. So if there is anything in kind of that space that he and his staff think that we need to deliberate and formally take consideration of, I'd like him to include it in that context.
What I want to make sure too, we did send out some stuff that's available on our webpage, Small Business Resource Guide, which is one of the most comprehensive things that the federal government has given us. It has payment protection loans. It tells you how to apply for a loan and the process, small business, fewer than 500 employees. So it's on our webpage, and I would respectfully ask for board members that do social media, if you could push that information out for us. Because once this has gotten out, a lot of the phone calls we were getting are starting to go down. They know that there's payments, there's loans, there's opportunity for grants. So that document, if you can get that out for us, will be very much beneficial for us.
Yeah, and I, speaking for my office, we're doing that. I know others are as well. But again, you know, I'm interested. There may be others interested in really kind of understanding the totality of what is under our control, whether it be what we might be able to do in terms of even commercial leases. I know the city of Sacramento and other jurisdictions across the state have looked at some relief for small business as it relates to commercial rents. But that's what I was really driving at a couple times now that I've mentioned in previous board hearings, because I think it's incumbent upon us to really leave no stone unturned in terms of exploring those things that are under our direct control that we can do to give our constituents the relief that they need and deserve in a time that's unprecedented in terms of the impacts that they're encountering.
Sure. I was just a couple of one follow on Nav on that property tax issue. I did have one other question, and I, again, recognize we do have no authority over the deadline, but the imposition of late fees and other penalties as to whether the county has any latitude with regards to that. So if you could maybe kind of bundle that in.
So I can actually address some of that today, and I think I'm looking at Lisa too. We do have under circumstances right now the tax collector can do it. They work individually with folks that can't do it. So that authority does rest with us, but there's criteria as we go through.
Okay, so you'll give us some more information about what that would entail, if it's case-by-case basis or?
It's a case-by-case right now.
And this came up yesterday as well from Supervisor Kennedy had a constituent concern. So we will be providing a memo to the board regarding that issue. There is a provision in the Revenue and Taxation Code, but as Nav said, it is on a case-by-case basis, and they would have to have specific justification for the reason.
Maybe we get some understanding what that justification is. If it's the COVID virus, that, you know, that's never been a justification before, but it may be this time. So
No,
Yes.
that's not one of the justifications.
I know.
And again, I want to belabor the point that if we do not have that, we do not get taxes by date, we're in effect, we're out of cash flow.
Right.
And that's a circumstance I don't want to be in. But having said that, if we can accommodate some of the fees that we're charging, absolutely we want to look at that.
Okay.
And that's the message we've been giving when folks have been calling us, because that's the biggest deadline that folks are facing right now. We do tell them case by case. We do respectfully say, and sometimes they disagree and we get yelled at, but that's okay. But the virus is not a case not to have that come in. And as you know, we're only 16% of the property tax that comes in. This has a much further impact on schools, fire agencies. We're not the only ones in it.
Right, but it's circumstances that may, again, involve people's health or lack of ability to,
And we do look at that. I mean, if they're, no, I get it. I understand.
Okay. I know you do. Okay, good. And I just wanted to pass on the last comment here. Kudo, I was invited to join a conference call this morning, and maybe other members have been or will be, but just related to the construction and building industry and folks who are involved both in construction activities, but certainly suppliers, and they were very complimentary of Sacramento County, certainly Mr. Hartwig and you, Mr. Gill. I know they said that somebody had spoken to you yesterday regarding, one, our health order, which has provided that to be an essential service to allow construction ongoing, but secondly, that just our ability to keep permitting as well as inspections, continue those activities in the field, again, taking proper safeguards and so forth for our employees, but also obviously encouraging the industry, which they pointed out to me a number of things they're doing, both on-site, but as it relates to folks who are employed in the various crafts and trades. And so I just wanted to pass it on. Yeah, they
I
were
appreciate
very complimentary
Thank you.
of Sacramento County, and certainly mentioned you and Mr. Hartwig's departments as well. So.
The issue that came up is jurisdictions that hug the ocean west of here are starting to say construction is not permissible. And there was some panic that our folks started having, and my message to them is at this point, we consider that to be essential. What they're doing over there, we can't control that. And they do have folks that commute back and forth from here to the Bay Area, but that's the Bay Area counties doing it. That's not where our headspace is. And we want to continue that. We will have our planning permitting to keep the economy going at this point, rather than if it becomes to a point that it's an absolute health issue, then that's a totally different conversation, but we're not seeing that in Sacramento County. The Bay Area might have it. We don't know what their situation is, but that's them, not us.
Supervisor Kennedy.
Thank you for that, and I really appreciate that position, because I think shutting down the economy right now would not be advantageous to anybody. I guess kind of dovetailing on Supervisor Natoli's issue regarding the fiscal impacts that people will be facing, and how we can help mitigate that to the degree that we can and still stay solvent. Also, our policies and procedures that I would like us to look at department by department, which would minimize the level of contact that the public has to have with staff or others. As just an example, a constituent contacted me because they had home birthed a baby, and in order to get that baby registered and get a birth certificate, if you're home birthed, we require one of the two parents and the child and even the midwife to come in to get that child registered. Now, there is a whole lot of public contact that is totally not necessary in my mind. So that's just one example. I'd like to look at where we are looking department by department at policies in which we can limit public exposure during this time.
Absolutely.
Thank you.
Okay. I just wanted to make a brief mention of the fact that in my role serving as this board's representative to NACO and as chair of the NACO Health Policy Committee, I was on a conference call with dozens of others in NACO leadership 2 days ago, and on the call were CDC officials who were able to actually take a number of our questions via email simultaneously while we're participating on the call. I submitted a couple of questions, one being specific to testing infrastructure and when counties across the country can expect any noticeable change in the mass availability of complete test kits. I know some of them have been incomplete, and unfortunately, there wasn't much new information that the folks from CDC that were on the call contributed. But I think they're well aware that it's not just this county; it's the other 3,068 counties across the country that have the same concern and interest. I also asked a more pointed scientific question relative to what data or emerging information there is about the development of antibodies in patients that have had COVID-19 that are recovered, and whether or not there's any noticeable kind of defense similar to the ones that we experience when we have seasonal flu. In other words, you get the flu once, and you're more or less, your body's more or less has a defense against that same flu strain. And they're very cautiously optimistic, but I think they mentioned that it's somewhere in the 90% plus range that those that have had COVID-19 are showing a likelihood that they do have that defense. So that's a bit of good news. Okay, if there's no further questions or comments by the board, we are adjourned.